How can doctors diagnose a child's UTI without a catheter? Imagine your child is feeling unwell and you suspect a urinary tract infection, but you want to avoid uncomfortable procedures like catheterization. How do doctors figure out if your child has a UTI without using a catheter? Well, they have several safe and effective methods. First, they often collect urine samples in ways that don't involve inserting a tube into the bladder. For children who can use the bathroom, a midstream clean catch is preferred. This means the child is asked to clean the genital area, then start to urinate and catch some urine in a sterile container. This method helps reduce bacteria from the skin contaminating the sample. For infants or children who aren't toilet trained, a urine collection bag can be placed over the genital area. The bag collects urine as the child urinates. While this method is easy and non-invasive, it does have a higher chance of contamination from skin bacteria, so it's mainly used to rule out infection rather than confirm it. Another newer technique is called the Quickie method, where cold saline-soaked gauze is gently rubbed on the lower abdomen to stimulate urination. This can help collect a cleaner sample quickly without discomfort. Once the urine is collected, doctors perform a urinalysis, which is a simple dipstick test. This test checks for signs of infection like white blood cells, bacteria, and specific markers called leukocyte esterase and nitrites. If the dipstick shows positive results, especially both markers together, it suggests a UTI is likely. However, a urinalysis alone isn't enough to confirm the infection. The next step is usually a urine culture, which is the most accurate way to diagnose a UTI. It involves growing bacteria from the urine sample to see if bacteria are present in significant amounts. For samples collected without a catheter, a clean catch specimen is ideal for culture. But if contamination is suspected or the results are unclear, doctors might consider other options like catheterization or a more precise procedure called suprapubic aspiration, which involves inserting a needle directly into the bladder under guidance. Doctors also look at the child's symptoms, such as fever, pain during urination, frequent urination, or abdominal pain. In very young children or infants, symptoms can be subtle or nonspecific, so urine testing becomes even more important. In summary, doctors diagnose UTIs in children without using a catheter mainly by collecting urine through clean catch or bagged samples, performing dipstick tests to look for signs of infection, and confirming with a urine culture. They reserve catheterization or more invasive procedures for cases where non-invasive methods are inconclusive or not possible. Always remember, if you suspect a UTI, it's best to consult a healthcare professional who can choose the safest and most accurate testing method for your child's specific situation.